Namaste, I'm Dr. Vandana Gowdy, Senior Obstetrician Gynecologist working in Apollo, Navi Mumbai. And as we all know that this is the month of awareness for endometriosis, I'm here to talk to you a little bit about what is endometriosis. So my talk is going to be in 4 parts. The first part is I'll try to explain to you what is endometriosis. The second is we will talk about the symptoms. The third will be how to diagnose it, and the fourth part will diagnose and treat it, and the fourth part will be what can we do to prevent endometriosis. So endometriosis is a chronic inflammatory disorder where the lining of the uterus gets displaced from inside the uterus and goes and falls in any other part of the body. And it's a chronic inflammatory condition and also known as retrograde menses. So this endometrial lining which comes from the uterus, it will fall into areas which are closest to the uterus, like the fallopian tubes, the ovaries, the back of the uterus and the intestines. But sometimes this lining can also migrate away in distant areas like your lungs, the undersurface of your lungs, that is the diaphragm, and even sometimes it can migrate and get installed or implanted in a C-section scar. So what happens is when this endometrial lining goes away from its original position, it activates your body's immune system, and your immune system then tries to contain the spread of this endometrial tissue to restrict it to the place that it has fallen, and in doing so it creates a web-like fibrous tissue on the deposits of that small blood, and this actually causes harm to your body because this fibrous bands will then cause tissues to start sticking to each other and to get displaced from their original position. So the crux of the problems of endometriosis happens because of this activity of the body. Now, what are the symptoms of endometriosis? The most common symptom of endometriosis is pain, and this can be either a menstrual pain, it can be a pain during intercourse, it can be a pain during defecation, that is when you pass stools, or it can be just a generalized deep pelvic pain. Now this kind of a pain, a lot of women have pain during their periods and they take some painkillers and they assume that it is normal, and most of the times really it is. But the typical endometriotic pain is it starts a day or so before the period and it peaks at the time of period and then it becomes less. And as the disease progresses, the intensity of this pain will go on increasing. This will then lead to, sometimes the woman has to go to an emergency room in the middle of the night to seek painkillers and injectable painkillers. The proportion of pain is not necessarily proportionate to the amount of deposits that have leaked back into the body. So sometimes you have widespread endometriosis but the woman will not even know that she has it, and sometimes a very small deposit can lead to very, very severe pain because it is where the deposit has fallen. Sometimes it has fallen on a nerve ending, sometimes it has caused the intestine to get stuck to the back of the uterus, and these conditions are more painful. The second symptom of endometriosis will be heavy menstrual bleeding. Now see, there is a co-condition or a sister condition of endometriosis called adenomyosis, and they very often coexist. In endometriosis, the blood is flowing back into the cavity of the woman's body. In adenomyosis, this blood is leaking back into the uterus. So in the muscle of the uterus, the lining of the uterus is now leaking back. This is also going to cause the muscle to become fibrous. Instead of being a soft, pliable, stretchable uterus, now it becomes a hard, non-flexible, fibrous, round uterus. The normal shape of the uterus is pear-shaped. So the uterus starts becoming larger in size and it becomes globular like a cricket ball. From a rubber ball consistency, it becomes like a cricket ball. And this causes a response alteration to the hormones which are coming from your ovary. So that means that the amount of lining being produced inside the uterus with progression of the disease goes on becoming more and more, which leads to heavier and heavier bleeding. And the more the heavy the bleeding, the more there is leakage, so this condition then slowly progresses. Okay, now this bleeding is usually cyclical. That means you will get a predictable period, but sometimes as the disease advances, then the bleeding can also become prolonged. Before the onset of period, there will be small amount of spotting which can then continue after the period for even up to 10 to 15 days. And this can become very distressing for the woman. The third common symptom of endometriosis is that she may not actually know that she has endometriosis. She may first come to a doctor with difficulty in getting pregnant. So endometriosis commonly causes infertility, and the cause of infertility is typically the change in the orientation of the pelvic organs to each other. Now we know that for us to conceive, the egg which is produced in the ovary is released out from the ovary around the 14th or 15th day. And typically, if you imagine this is the ovary, the tubes of the body, the tubes of the uterus are lying on top of the ovary, so that when the egg is released, it goes directly into the tube. Now, because of endometriosis, the tube, the ovary and the tube may get displaced from their original position. So the tube may go and get stuck at the back of the uterus, the ovary may go and get stuck somewhere on the side, and that it cannot catch the egg. That is the commonest reason for difficulty in conceiving. The second is the tube itself, even if it catches the egg, the tube itself, even if it's in the normal position, may be damaged because the blood flow which is going into the tube constantly will make the tube rigid. It will make the tube sometimes, it makes the tube defective and it makes the tube diseased. And also the blood which is lying inside the tube will actually cause, sometimes even if there is a fertilization of the egg by the sperm inside the tube, the egg will still die because of the presence of the blood inside the tube. Okay, now how will I diagnose this condition? Okay, whenever a patient comes to me, a very detailed history, asking very relevant questions of the type of pain, the amount of painkillers and all of that, then a physical examination, a bimanual physical examination. Your doctor will feel that sometimes the uterus is appearing larger, feeling larger. The movements when we move our fingers inside your vagina, the uterus is feeling tender, there is movement pain. And very many times there are no findings on an examination. If you have a suspicion, you will go for an ultrasound. Now an ultrasound may not really pick up endometriosis, because if it's a widespread disease, the orientation of organs to each other cannot be seen on an ultrasound. The thing that can be definitely seen on an ultrasound is if you have something known as an endometriotic cyst. It's also known as a chocolate cyst. It is a cyst-like collection of a big quantity of blood which has leaked back from the tube and got stuck on or around the ovary. This tissue is then covered by a fibrous band, like as I said, the body tries to contain it. And when you try to cut it, you will find, many years ago when the surgery was first done, you will find that it leaks out a altered blood which looks like liquid chocolate, and therefore it was also called as a chocolate cyst. Now this kind of a cyst can be picked up on an ultrasound, and if you want to improve your diagnostic ability, plan the treatment better, and MRI will give us a better idea. So an MRI will not only diagnose this chocolate cyst and confirm that it's a chocolate cyst, but it will also tell us whether the intestines and all of them are stuck to the back of the uterus. So it helps us to plan the treatment better. The next thing that can be used to diagnose it is a blood test, which is a tumor marker called CA125. It's usually raised in endometriosis, and your doctor will guide you what is to be done when it is raised. Now, what would be the treatment of endometriosis? So basically, there is no treatment of endometriosis. We can only treat the symptoms, and we can control the progression of the disease. And the only way to do that is to basically stop your periods, because we cannot stop the leakage of the blood back into the uterus or into the abdominal cavity. We can only stop your periods. Now, yes, I know that sounds very scary, and when you hear that there is going to be no periods, the first thing you worry about is, will it lead to menopausal symptoms? What we need to understand is, your period is not controlling your hormones. It's your hormones which are coming from your ovaries, not from your uterus, which are controlling your periods. So if I give you any medication that will stop the uterus from getting activated, which is what causes the periods, I'll be able to naturally control this condition. Now, there are several natural events in your body when your periods don't happen. That is when you're pregnant, when you're breastfeeding your child, and menopause. And these are three conditions which cause the disease to become less active. But if I want to achieve it through medication, then the medications that I would use would be either in the form of injections, in the form of tablets, or I will give a local intrauterine device which is releasing hormone directly into the uterus. And now, knowledge is power, and so ladies, I will request you read up about it and don't get scared of endometriosis. An early visit to your doctor will help you to rule it out and will keep your disease in progress. Thank you very much.